now, we have 5 countries within Africa that have been able to achieve this. And the good thing about the people who have gathered here is that Tanzania falls in one of these countries. So that's a milestone. Clap on your side. So generally, things like HIV deaths are going down. If you look at 10 years ago, we had about 860,000 HIV deaths within Africa. Right now, it's about 380,000. ARV coverage, 10 years ago, I think it was about 10,000 patients. Right now, we're talking over 25,000 patients, which is on average about 82% of our patients being on ARV treatment. In terms of newly infected, this area we are also doing well as a continent. However, there are specific target groups that we need to look at carefully. Next slide. In terms of tuberculosis, 2030 is 5 years away. 5 years and 3 months away. Yeah? And we need a world that is free of TB. I'm not sure how feasible this is, especially if you consider the impact of COVID-19, where a lot of resources that were to go to TB went towards COVID testing. So we need 90% reduction in the number of TB deaths in 2030 compared to 2020 milestone, which was 35. Tanzania is at about 65, which is doing well for especially considering Tanzania is listed as one of the high burden TB countries in the world. Of the 30 of them, Tanzania is in there. We need 80% reduction in TB incidents by 2030 compared to 2020 milestone, which was 20%. And then no TB affected households should face catastrophic costs by 2020. If you look at the current data, 45% of TB patients in TZ are facing catastrophic costs. This is something that we need to relook at and see how we can help these patients. If you go to the next slide, we will look at cervical cancer. Again, the WHO goals is that 90% of adults be fully vaccinated with HPV by age 15. I'm not sure whether we're doing that within this country or within the continent. 70% of women screened using a high performance test by age 35, and again by age 45. And then 90% of women with precancer treated, and 90% of women with invasive cancer managed. So cervical cancer actually is one of the most common deaths of cancers within Africa, and it accounts for 22% of all female cancers here. And we have only 27 countries that have introduced HPV DNA screening, which is recommended by WHO. Again, another good thing for our country here, Tanzania, is that we have recently introduced HPV DNA testing. So again, clap for yourself. Yeah, great. So it's a good thing we see countries are doing good in terms of these kinds of diseases, but remember, these are diseases of public health importance. What about the NCDs, right? So if you go to the next slide, this one has talked about allocation. Please go to the next one. So as Roche, we offer solutions that can help you to cater for these kinds of patients. And these come from near patient all the way to high throughput settings. So we are able to cover all these disease areas that are infectious diseases, but our solutions require you to be in a setup that is more of a higher throughput, except for the smaller instrument here, which is a COVAX 5800. And the good thing is that your HIV program has access to these instruments. However, we need now to start looking at more of a patient-centered approach, where the HIV patient is not a HIV patient in this lab, but in another lab on the other end of the town is a TB patient. Chances are this is one and the same patient. So there is what we call integrated testing, where if you go to the next slide, please, where now we can look at these patients as one patient. If it is the HIV program, let them accept TB patients. The same machine does not require anything new, meaning the TB program does not require to incur costs, does not require to go through any new trainings. They just bring in the TB samples and they run through this. It's the same with HPV, it's the same with hepatitis, it's the same even with the monkeypox that we're talking about right now. So if you go to the next slide, please. The same thing again, but now let us look at the NCDs. Please go to the next slide. So again, the NCDs, as I said earlier, are projected to outpace communicable diseases within the current decade that we are in. So before 2030, as the number one cause of death in Africa. If you look at the risks that will lead to stroke and heart failure, you have your hypertension, cardiomyopathies, and all this, if you look down here, what you're trying to show is you'll see that issues like hypertensive heart disease and cardiomyopathies are on the rise. Things like rheumatic heart disease is not going up. However, things like ischemic heart disease is going up. And this is all due to risk factors that include the things we're eating, the lifestyle we're living, and however, there are other issues such as lack of quality research, underfunded health systems, limited accessibility and affordability to essential medicines, preventative services, as well as skill shortages. Next slide. So at Roche, we also have solutions that can cater to your patients from the POC, where we can look at your diabetes and cardiovascular issues through the COBAS P101, COBAS Pulse, and then in terms of clinical chemistries, the COBAS C111. And when you go into a higher throughput setup, we have the COBAS P1, the COBAS Pro, and also what we call the total lab automation, where we really ensure there is no human interference in the sample. The entire process is automated. And we have one solution here being set up in Temeke, so that would be a very good site in future for labs and ministries and programs to go and at least get best practice and experience. So generally, we can also integrate not only from an communicable disease perspective, but also from an uncommunicable disease perspective. Remember, your HIV patient also requires tests like LFTs and all this. We can also integrate to that level, where now we are looking at the wholesome disease management and the patient is taken care of fully as one. Please go to the next slide. The next one. So in terms of cancer in WHO Africa, we're also seeing an increase in that. New cases are expected to rise up to 70% by the next 2 decades. And that is at a global view. However, if you look at the number of deaths, about 70% of cancer deaths occur in middle and low income countries, where we are. So the cancers are expected to rise by up to 70%, yet around 70% of the deaths occur here. It means there's something we're not doing very well that we should do. And if you go to the next slide, at Roche, we do have solutions for this and the pathology lab. And if you look at the patient journey from presentation to examination and imaging, once they decide that a biopsy is needed, there are pre-analytical solutions. However, we do not have them. But when it comes to staining, we have, for example, the Ventana, which will be doing a primary staining. And if the cell is found abnormal and we need advanced staining, we also have advanced staining solutions. And this can also be linked to digital pathology, and which will support you in terms of clinical decisions. So we can link the patient from the beginning all the way to the end for all these cancers that are listed here, and we have over 300 markers for each. And this can also again be linked further to treatment for your patients. A good place where you can experience this is at KCMC. Profits here, he can definitely vouch for that. So next slide. So generally, there are challenges that we are facing within Africa, from skills, from resources, to testing demands, to non-integrated testing, to competing priorities. However, at Roche, what we think is if we can come together and stop working in silos, where we work in an integrated manner. We bring together different departments, different programs, and we use the existing resources fully. We can be able to cover some of these problems without incurring further costs. A country like Nigeria is doing this very well, where they're integrating their HIV, TB, hepatitis, and HPV into existing systems. For example, last year they were supposed to buy about 500 gene experts. All that money did not go to instruments. It went to kids. Because the instruments that they had in the HIV program were underutilized. The business one, I think, was being used at around 48%. And I'm sure this will be the same case even here in Tanzania. So if we go into the next slide, we can look at the value of digital solutions. We have digital solutions such as Nemify, which will help you in terms of medical insights, operational excellence, and even infrastructure to help you in your decision making. Next slide, please. So generally, as you have seen, there is a shift in epidemiology, and this is resulting also to a shift in mortality. There is need for us to look at in vitro diagnostics again. As John said, 70% of clinical decisions are dependent on this. And then the investment by ministries of health is less than 2%. So we need to relook at how we can use whatever is existing, add on to it and use it efficiently so that we can be able to scale and also reach more patients. There is also value in adopting digital solutions. In the world that we are in right now, I think the way it's going digital. And at this point, I'll stop and hand you back to our moderator, John. If there are questions, we will handle them afterwards. Thank you.
Let's give a round of applause to everyone who takes his seat. And again, I never cease to say thank you to all of you. When you look at the work that has to be done, it has to be done to health workers, especially in Africa. It's daunting. In our application by the World Health Organization, they mentioned that 25% of the global disease burden is in Africa. But Africa only has 1% of the health budget for the world. And I can even tell you the percentage of health workers in Africa compared to global percentage, very low. So you are among the few people that have such a huge mountain in terms of delivering care to Africa. But I'm confident with collaboration, with putting our minds together and giving it our best, we will be able to overcome. The next bit, we're going to have a panel discussion, and I will be inviting our panelists one by one. We'll have about 40 minutes of a few moderated questions, and we will then open it up to us as the audience. So in case you have any question, feel at liberty to write it down. I will give us an opportunity to ask the panelists as well as Edwin directly our questions. So the first panelist I'm going to invite on stage is one of us from the land of Tanzania. He is Dr. Heri Mapesi. Dr. Heri Mapesi is a medical doctor, a graduate of Hubert Karuki University here. After pursuing his medical degree, he left for a while to upskill his skills. He moved to Switzerland, where he did his MSc as well as PhD, specializing in epidemiology. He has worked as head of clinical trials at Ifakara Health Institute and is now currently serving as the lead for Roche Diagnostics in Africa for medical, specifically infectious diseases. Let's put our hands together as Dr. Heri Mapesi joins us on stage. Now I'm seeing the names are falling down. I hope the actual people don't fall down as they take their seats. Thank you. Our second panelist is a lady by the name Lucy Milu. Lucy leads market access initiatives for Roche in East Africa and has also led initiatives for West Africa. These are the people who are continually thinking through the many challenges in our healthcare systems, leading through partnerships and collaborations, and asking ourselves, how do we make it work when we come together? Lucy has training in policy and partnerships from the London Health School of Economics. She has a bachelor's degree in chemistry as well as a master's in occupational safety and health, and she will be joining us on stage. Karibu sana, Lucy, on stage. Our next panelist is someone who plays a very critical role in making sure that global innovations find their way into Tanzania. He is Mr. Michael Ratos. He leads one of the leading distributors in this country who are science, who ensure that whatever it is that global companies are building up to tackle health challenges have a channel in which they can come into the country. He has people all over the country either attending to instruments, training our laboratory workers to make sure that everyone receives the care when they need it, where they are. Let's put our hands together as we welcome Mr. Michael Ratos on stage. Karibu sana, Michael. And our final panelist who will be joining me on stage is a man of many hats, pretty much well known to many of us. He is Professor Gideon Gabriel Masenga. He is the man who leads one of our largest hospitals in the northern region of the country. That's the Kilimanjaro Christian Medical Center with 1,300 healthcare workers. And I keep telling him that he's not only helping Tanzanians but Kenyans as well, because a good number of our patients do come down when they need care. Professor Masenga is a medical doctor by training, trained at Muhimbili. By the time he was becoming a doctor, I must have still been on exclusive breastfeeding as my dietary requirements. He then moved on to specialize in gynecology when he pursued his Master's of Medicine in Gynecology, and later pursued his PhD in Denmark, specializing in pelvic disorders. He has done a lot of work, especially in driving care around fistulas and urogynecological disorders. Besides that, as the leader of KCMC, he has driven significant partnerships, significant groundbreaking initiatives, all in a bid to offer world-class healthcare here in Tanzania and now. Let's put our hands together as Prof. Masenga joins us on stage. Karibu sana, Professor. I will join them as well, but my CV is not as elaborate. My job is to ask questions. They have the answers. Great. That's our agreement with them. So I will start off with you, Professor Masenga. You have an extensive experience in the healthcare system here in Tanzania and beyond. And I would be keen to understand from you, what do you think is the role of private players like Roche and the rest in supporting strengthening of laboratory operations in Africa?
Thank you, John. First of all, for the kind introduction. I think you've said some credit which I didn't know, but thank you for that kind of introduction. Well, I'll go straight to your question. Citing my background as a leader of a zonal referral hospital for the north part of Tanzania, and experience in working in partnership with Roche, I can say with confidence that Roche plays a significant role in enhancing diagnostic capability and also improving testing capability in many areas, many hospitals in Tanzania, but in Africa and globally. So that I can say without any further. But Roche does that through a number of ways, strategic issues. And number one thing, which is their value, is capacity. So I can say Roche invests heavily in capacity building, training and retraining of healthcare professionals, and also lab technologists, lab scientists. In so doing, they ensure that our health professional and lab technologists, they have important skills and knowledge to use the equipment and provide standard of care in terms of diagnostic. That's one aspect which I think, as Roche, you are doing very well. Number two, Roche embrace PPP, public-private partnership. And this is one of another value which is good. You work with the government and non-governmental institution, and you work as a team in trying to improve infrastructure, in training, in setting system, and the like. And all of this also make easy to improve for diagnostic in other area. Apart from that, we've seen from the presentation here, we have number of solutions in terms of diagnosis. That is another very important thing. We have number of solutions in terms of diagnostic, and this solution, I can say they are cross-cutting from the primary to the tertiary. So this solution, they help on this hospital. I know you have a lot of things like molecular, immunoassays, point of care, and this also, in one way or another, add to the improving quality of care in terms of diagnostic. Of course, the other part which for us as a tertiary hospital, we've seen is also support in tissue diagnosis. And I can tell you, this is an area which, as a country, we're not doing well in terms of tissue diagnosis, in terms of pathology. And we've seen the global pattern of diseases, the shift to non-communicable diseases, and cancer. And if you don't have a proper diagnosis, there's no way you can treat it. So we really acknowledge this support as partnership and the contribution of Roche in empowering hospitals in all levels in terms of all this diagnostic.
Thank you, Professor, for highlighting that capacity building, even going into specific diseases. One of the highlights for Tanzania that was mentioned is the fact that we're making significant progress towards certain disease areas like cervical cancer. And I would be interested to hear from Lucy. There are so many barriers when you think about accessing care, especially cancer care. What's the nature of support and initiatives that private sector organizations working with governments and other partners drive to make it possible for some of these life-changing tests, life-changing innovations to be accessible to patients in Africa?
Thank you so much for the question, John. And I think it is a timely question based on what Edwin has presented. And when the World Health Assembly 2023 passed the resolution on increasing access to diagnostics, one of the 15 pillars they established was what Professor Masega has said in terms of everything is underpinned around partnerships. No one single stakeholder can achieve everything that is required to do that. In regards to cervical cancer, and I usually look back and see the much we can do, is looking at the whole patient journey. Tanzania, unfortunately, sits in the belt of the 21 high burden countries globally, and a lot has been done, and well done to Tanzania in terms of your progress towards primary prevention, and that is the HPV screening with very, very good numbers. Actually, you're globally among the countries that are leading to that. And what that tells us is something is happening and in the right direction. The community is aware, there's community embracement of the whole conversation. And when we are embracing and working towards collaboration with different stakeholders in regards to the second pillar, which is the 70%, that talks about access to high-performing tests through HPV DNA testing. And congratulations to Tanzania, because you rolled out the national cervical cancer screening program and have incorporated HPV DNA as a testing modality. Is that these women, if you look at the statistics released last year in terms of global data 2022, is that late presentation coupled with your high numbers in terms of the women presenting is 50% of that. Those women who present passes on because you're stage 3, stage 4. However, appreciating that cervical cancer is a preventable disease, all of us, how do we bring each other to the table? All the way from the awareness, both the public and the healthcare providers, and Roche has been that. We are currently having conversation with the government. We are also having conversations with stakeholders supporting this cervical cancer conversation. And the question we are asking ourselves is, how do we send out information that is impactful, healthy information that converts this woman going around everyday business to turn up for a cervical cancer screening? How do we get them early? How do we reduce the burden in terms of the healthcare burden, in terms of late presentation? And a number of studies also have been done that there is also the societal implication in terms of your maternal orphans. There's also the economic burden to the economy in terms of the GDP. And what we are saying is, how do we bring together? In terms of the screening, we have collaborated with the Ministry of Health, and right now we are supporting HPV DNA testing, and we are looking forward to more women presenting on being caught early. In terms of capacity building, and thanks Prof. talked into it, there are various conversations that have been going on. And when you build a robust laboratory systems, it doesn't work in isolation. How do you cover end-to-end? How do we even harvest quality data such that way forward, the ones who have access to global data, part of the feedback comes back at us, maybe not having very good quality data. And the ASLM did some survey in a number of countries, and they talked about, if you look at the vertically funded programs, they have very good quality data. How do we extend the quality of the data captured to reflect? One is it will guide the investment in terms of prioritizing the resources to cover the preventable diseases like cervical cancer. How do we get these women allocated for finances in terms of the prevention rather than them interacting with the healthcare system? We are looking at the whole patient journey, despite us being only in the 70%, which is the screening, because we also believe that when you cover the whole patient journey, the impact is to the society, the impact is to that woman who will be caught early, and the impact is also to the economy, because this strong woman will contribute to the society wherever they are. And these children that are already, because you look at the presentation age, is quite early for East African countries, is this woman will also contribute to a number of moving beings in their childbearing age. And we will also have very healthy, well kept, reducing the burden in terms of the orphans as a result of cervical cancer. So our partnerships cut across all the way from the health information to the screening, and also in terms of linkage to care. And I've started having conversation in terms of survivorship, because we can't do away with survivorship, because then we have to talk about how do we have lived experiences helping us drive the message home that it is doable when we interact with the healthcare systems much earlier. Thank you.
Thank you, Lucy, for giving us the perspective from the whole patient journey and how do we strategically think through how we partner, how we collaborate to make it work for the patient. Michael, I'll come to you. You lead a team that plays a very critical role, and that's being that helper or channel for global players to be in the local market. And you have been in the lab space for a while. I would be keen to hear from you. First, what do you see the role of science in the healthcare ecosystem as being? And two, as you have continually worked with laboratories, what are the key pain points and challenges that you continually hear as you deliver care and solutions to the labs? Thank you.
Thank you so much, Jacob, for the question. Yes, in terms of your first question, as to where science positions itself, or other distributors for that matter, it's bringing quality care to the region. As you have seen from the previous presentations, there's a lot of emphasis out to the west versus what we get here. So our goal ideally is to bring that service locally as much as we can. And how we do it is partnering with companies such as Roche and other global partners to bring that innovation to the region. So we work with partners, some of who are here, the likes of KCMC as one of the bigger hospitals, to smaller clinics, because we want to get to down to the ground, because that's where our care begins. So we address all the concerns by providing first-class service in terms of instrumentation. We do make sure the turnaround time of the instrument is down. We're able to attend to it quite rapidly so that diagnosis can happen, because that's where most of the challenges are about. In terms of availability of reagents, in terms of different business models, because as we have heard, funding is a big issue in this part of the world. So we want to make sure that we can address under the smaller clinics. So looking at the scale, we have a variety of instruments that we can hopefully start some on the ground, and then through a hub and spoke model, like if there's more need higher up, then we're to direct samples. So we play a role along the supply chain and are able to address some of those concerns and like that. In terms of challenges, skills is a big challenge. So how do we address it? It's again providing solutions. So constant training. We go around the country. We have teams. We have offices situated around Tanzania and in Zanzibar. So across the southern highlands to the links to the northern highlands, we have personnel who can easily access some of the facilities and offer training where we notice a gap. Funding challenges is another challenge in this part of the world. So we offer different kind of models, right? We have things like placement models where we place equipment, and through the reagent pricing, a lab is able to afford that equipment and be able to offer services to the population. Again, it depends on the size of the institution. So small institution, small instrument, a large instrument. Logistics, we're registered, and we make sure that we are in line with all the regulatory requirements as far as quality is concerned. We are ISO certified. That means like whatever standards that we adhere to both at the manufacturer level are carried down to the ground. So making sure like that quality chain is maintained. And yeah, I think that's what I think.
Thank you, Michael, for highlighting some of the nuances that are sometimes at what you would call the bucket of healthcare. And you have to think about supply chains. You have to think about reagents. It's until I moved to this side of the ecosystem in healthcare that I learned there are reagents before I get a test. I would only go to a hospital and to be can't do that test, and I'm wondering why, and you have the machine. And it reminds me of the challenge that Africa faced when the whole world was in a crisis and we had COVID. And innovative technologies were being manufactured, and we were not getting any of them in Africa. And Dr. Henry, I would be keen to ask you a question. Of late, you have been monitoring trends in Africa. There has been a significant retreat by significant global players in the pharma space, either closing shop in Africa or feeling like this market is not good enough for business. What is Roche's bigger plan for Africa? Are you also going to be winding up? Or what's that growth like? How are we seeing ourselves in 5-10 years in terms of making care and innovation a reality here, the same way we have great healthcare in Europe, in America, and other places that you play at? Thank you.
Thank you very much, John, first for your kind introduction, and it's a real pleasure to be here. So, I wanted to start first by quoting the paper that we shared, the Lancet Commission Diagnostics. Only 19% of patients have access to basic diagnostics in low and middle income countries. And in the same paper, if you increase that number by 10%, you can save more than 1 million lives every year. So as Roche, like Glenn mentioned, some of the companies are getting out of Africa. But what we did last year, we launched a new 10-year strategy. So our plan or our idea is how do we increase access to diagnostics 10 times like now our patients are receiving. When you look at how many patients we reach now, it's around 50 million across Africa. 50 million people that are getting tested through Roche platforms. But in 10 years, we want to reach that number to 500 million because we think 50 million is still like a drop in the ocean. In terms of tests, we are talking about more than 300 million now, and more than 300 million in the next 10 years. So we know in order for us to achieve that, we need new innovations, right? And that's where we do the work, for example, at SMC with Professor Masega and the team, really to drive that part of diagnostics in Africa. Now, maybe you may ask, what about Tanzania? What are you doing? I'm also Tanzanian, right? So what did you do in Tanzania? 10 years ago, as a company, we launched a program called the Global Access Program. And the idea behind the program was how do we increase access to diagnostics, specifically HIV, viral load, early infant diagnosis, hepatitis B and C, tuberculosis, and HPV. So how do we increase access to low-income countries? And since the inception, now this year we had 10-year anniversary. Now in Tanzania, more than 70% of HIV, viral load, and early infant diagnosis are done through Roche platforms. So we are talking about more than 1 million tests in Tanzania now for HIV, viral load, and EID. And just recently, just 2 weeks ago, we started a program with HPV DNA because we know it's still one of the leading causes of deaths among women. So with this program, the country wants to screen 6.8 million eligible women by 2028. And for us, we have just 2 weeks ago, the plan is to do 85,000 for this year and to continue to reach this number. So this is one of the commitments in Tanzania that we do to support the Ministry of Health, National Control Program, and TB program in the future.
Thank you, Dr. Henry, for helping us appreciate that there is intention towards continuing to make it happen for Africa. While all the speakers have been sharing, one underpinning theme has been very loud that no one can get this done alone. It's always coming together as partners, and it's created the need for this year's Tanzania Health Summit has a significant element of quality as well as public-private partnership. Professor Masenga, you lead one of the biggest hospitals in the country, and I'm well pleased you are putting together a center of excellence in lab diagnostics. I would be keen to hear from you exactly what the work is about and how are you driving it through partnership. I'm sure you're partnering with many partners. How are you driving it through partnerships? Who are the partners and what is it that you're looking to make happen for the northern belt of this country? Thank you.
Thank you, John, for that. It's true that SMC, we are in the process of establishing a state-of-art, we call it a Center of Excellence Laboratory, which we think, we believe and we are sure it's going to enhance our diagnostic capability in terms of patient care, as well as training for many health professionals, especially the lab technologists, lab scientists, and all these people who are doing PhD and the like, and also conduct high quality research. So the idea we had, or the model, is to have harmonized, kind of centralized laboratory. Because for many years, as the institution, we have had 3 laboratories working in isolation. Clinical laboratory, we have research laboratory, we have training laboratory. But we thought we need to have one very strong lab which perform all the work under one roof, under one management. So this was the idea, and we are doing this work as a GSF institution, meaning the hospital, the university college, and the research center, working in partnership with Roche Diagnostics and also Philips University of Maba. So we think by doing this, we are going to enhance patient care. Because to me, I think that it's unethical to have two labs in one campus which perform differently. And from our experience, if we have such system, we always find the research lab is at the higher level and the clinical one is at this level. So we want all this lab to have one lab which does everything, so that the quality of care for our patient is the same level as a research subject, and to also enhance training. So we are doing this with our partners. The Roche is working very hard with us to make sure that we implement this in terms of harmonization. How do we do it in terms of harmonization to manage all the lab, but also give us technical assistance. And Philips request of Maba is one of our partners here. We are working together. So this, we are constructing a very huge, I can say, because it is a 5-story building only for the lab. It's a big thing. It's one of the largest lab in Tanzania. So people have been asking, why are you constructing a very huge lab just for diagnostic? But you've seen from the data, 70% of our patients, they go through lab for us to be able to benefit. So this is why we say that we have to do that, we have to upgrade, and we are sure that according to our weighting, we think by July next year, this lab will be in operation. And I wish to say that this would not have been possible if it was not for partnership. Because working with Roche, working with Philips University of Maba, we've been able to secure a grant of €2 million for this work. So this is a significant addition to this project.
Thank you, Prof. And an appreciation to Prof. Lenz, seated right there, who has been an ardent partner to this journey. When we see great things happening in Africa, we definitely always have a reason to celebrate. And good to see the clinical side, the research element, the university element come together to make this work. And when we mention of research, and labs are the center of research in any medical ecosystem, I would be keen to hear from Dr. Mapesi, being in the medical field. How are you as a team working towards managing inclusivity in research? One of the loudest challenges has always been drugs have been developed, research is being done, very little is being done in Africa. What's happening in Africa in the field of research? Thank you.
Thank you very much for the tough question. So at Roche, what we do, we have studies that we support in Africa, several studies. So currently we have more than 20 studies going on in different parts of Africa. Now, we have 3 types of studies that we support usually. So we have Roche-sponsored studies. These are the studies that as Roche, we develop a protocol and then reach out to the institute that we're interested to work with. So we have a couple of those happening in Africa. We have investigator-initiated studies, and these are the most common one in Africa, where a principal investigator develop a proposal, send it to us for support, and this could be in terms of reagents, it could be in terms of any capacity. So we support them in that. For example, I can give an example in South Africa now with our TB test that we're doing in Sputa. We're just supporting a study looking at can we do tongue swabs, for example. So those kind of innovation is what we're at in Africa for different studies. And I would encourage, if you're a scientist, if you're a PI, research institute, please remember that at Roche we welcome proposals that you think we can support you. We are very open and we don't have deadlines. So our platform is open any time of the year. You can submit your proposal. So, yeah, so we really encourage you that. The third pillar or the third type of study that we support is collaboration, where PA can come to us like as Roche, we want to do this kind of studies, and then we can probably, let's say, work on the proposal together until we reach the final, and then we can see how we support each other. But at the end of the day, the publication belongs to the PI, so we don't have any influence in data or publication. It's all belongs to the PI. All we do is support. So in summary, we have more than 20 studies that we support in Africa. And one thing I have to mention, we spend not more than 15% of our revenue in R&D. That's number one in the world. No company does that. So that shows how science innovation is very important to us as a company.
Thank you, Harry. And that affirms it. If any of you is needing to do some serious research, you have the gentleman who's from this land. Great. I would be keen to hear from the panelists, and probably now that Prof, you have the mic, you can start. When we think about partnerships, which is our theme for the gathering, what is it that makes a successful partnership? Because companies have different visions, government has its vision, a hospital has its vision, but when you have to drive a partnership, what are the key guiding principles that we need to consistently think as critical to make a partnership successful?
Thank you, John, for that. That's a very good question. As KCC, we have been managing a number of partnerships. We have almost, you can say, 50 partnerships. But there are some partnerships which are stronger than others. So with my 9 years as executive director of KCC, I've learned and have experienced what it makes to have a very good partnership. One aspect, number one, is to have a common goal. So in our project, we have a common goal. We want to enhance diagnostic, we want to enhance research, we want to enhance training. And all these are part of the strategies of Roche, part of the strategies and the values for Marburg University, for Philips University of Marburg. So we have the common goals. Secondly, having mutual relationship. That is another important aspect of this partnership. Having a very successful, long-lasting partnership. And thirdly, I can say is having mutual trust, transparency. All these are there. But again, very important is friendship, because we are human beings. We have to talk, we have to enjoy sometimes and work together in harmony. So these are the key issues which I think they are really very important in the management partnership. And also this will also address issues of sustainability, because people are talking about sustainability. But if you work with a partner, you plan your common goals, in good planning, at the end of the day, the project will be sustainable. I think I will address some of your questions.
You know, my mic keeps taking some time to come on, so I have to pause a little bit. Thank you, Prof, for that. And it's good you mentioned element of sustainability, especially when you think about partnership. I will ask Lucy to take a stab at the same question. And when labs have ideas, when there is a thought to be better, what is it that needs to be top of mind for them to be able to drive sustainable partnerships to make diagnostics accessible?
Sometimes it's hard to speak after Professor. so I will try. So he has given us the factor towards successful partnership. And maybe stepping back is that all the partnerships, whether it is public-private partnerships, starts and stops with governance. When the governance is weak, then the partnership does not have good outcomes, because then the factors Professor has given, that means there is one of the factors that will be shaking. In regards to conversations that have been currently going on, from even a governmental point of view, is there's a lot of conversation going on in terms of strengthening the governance structures in terms of public-private partnerships, because like we've seen it, no one stakeholder will get it done. In terms of sustainability, and I have looked at a number of pilots, initially they were meant to, it's like proof of concept, but they never went off, because simply when the funding stopped, then the partnership died. And the conversation Professor has said is, how do we figure out sustainability, how do we ensure smooth transition, such that when the funding, and you've said about trickling funding, because most of the partnerships have a bit of catalytic seed funding, how do we ensure that you're able to transit successively and that it has a long-term impact? We have had this conversation, and we are looking forward at how do we create long-lasting, scalable, sustainable partnership that have figured out both short-term, medium-term, and long-term outcomes, that have been properly mapped, that it has all the KPIs well done, it has all the accountabilities well checked, such that you're calling each other to the table in terms of, you needed to do this, this has not been done. And Prof has talked about the trust, because then we need to improve our conversations around how do we trust each other. And Prof, I may be wrong in this, but the conversation right now going on is, for a long time, when you come to the industry as a partner, we have had a lot of conversation going on that an industry can actually be a partner, and case in point is the KCMC partnership with an industry, so that we improve the access towards diagnostics access. I hope I have answered the question, Jenga.
Thank you, Lucy, for your insights. And a reminder that I will be coming to receive your questions to the panelists and Edwin, but not myself. I remind us, my job is to ask questions. They have the answers. Mr. Michael Rattle, I would be keen to hear from you in terms of partnerships and journey with labs. How do you help labs walk the journey, especially in terms of quality? How, when they show up at science and they need science to work with them through the journey, how do you ensure they deliver quality as a key partner?
Thank you, Jacob, for the question. So without repeating too much, so what we look at is when a lab would approach us, right, and in terms of quality. So the brand we carry, in particular Roche in this instance, is known for that particular aspect, right? So most of our partners would come to us looking for the quality. So when they come for partnership, it's mostly what we try and drive, and especially with the smaller to medium-sized labs, is win-win situation, right? Because they're in it to achieve a certain objective, and so are we as a distributor and our partners, as our principal partners. So we tie all those things together. So it's a transparent discussion in terms of this is a quality product, right? We have a lot of competition coming out of Asia, but they offer similar testing, but at a cheaper price. So that's where the quality aspect sometimes is questioned, right? And that's a prime discussion we have. So rather than repeat multiple tests trying to confirm a diagnosis, you partner with something like Roche, you're sure that diagnosis is accurate because of the back-end systems and the kind of product that you're dealing with. So a lot of customers that do appreciate that, because when they deal with patients, it's not, hey, please come today, let's run the test, then come tomorrow, let's repeat the test because we're not too sure of that particular diagnosis. But when they come and run a test with the Roche system, then they know that that's actually what it is. So maybe it's going further down the chain to look at further testing for that particular sample, but quality plays a big part in how we handle our discussions with some of the lab chains that we deal with.
Thank you, Mr. Michael, for reminding us that quality is an investment that does indeed pay off. As I welcome audience questions, and Prof, you said that we can hold you and your partners accountable to July having top quality diagnostics happening in Washington. When you think around the impact these quality diagnostics out of the center of excellence will have, what is the value to the patient as a clinician when they have access to quality diagnostics?
Thank you. With this project and what I've said, I'm sure that we are going to improve quality of our diagnostic capability, and that will have a direct impact to the patient in terms of accurate diagnosis. That's one. In terms of increasing the scope, we are going to increase our menu for diagnostic tests so that all the tests will be available. So there will be no need to send the patient to either Nairobi or South Africa for some diagnostic tests. As you all know, SMC is a zonal referral hospital. Our role is to provide super specialized or subspecialty to the people of the north part of Tanzania. So we are now having a comprehensive cancer care with radiation coming next year. We've started the construction of the cardiac center, neurology, neurosurgery, all this in nephrology. So we need to upgrade our test menu. And in so doing, if we have also accurate result, that in one way or another will also improve patient care. So patients will be happy, and also clinicians will be happy because they're going to get all the results what they need at the same sitting, and the efficiency of the lab also is going to be improved because we are planning. For those who have been to SMC is a huge complex. We have clinics everywhere, so we are also thinking, working with our partner for sustainability in terms of transporting sample using a system like cabling or something like that. So from the outpatient, they will go straight to the lab, and then if they are in the lab, we can escalate the result through the system easily. So all this, we are thinking to improve efficiency in terms of turnaround time. And the last thing is also training for our students. We have a university there, Manchester Christian University. They have a number of programs related to the lab. They have diploma in diagnostic, basic Bachelor of Science in laboratory, a lot of PhD that we've done there. For most of the time, we have almost 500 students. So are they training? So this lab, we have set a provision for students to be able to have practical session in this lab. So this is another added advantage of this project, which I'm sure 100% we are going to be successful.
Thank you. And we would want nothing but success for the sake of our Tanzanian people. I will allow us to ask questions. You can choose to direct it to a specific panelist or all of them. If there are many, you will allow me maybe guide a few of them, but I see Prof. Renz has his hand up. I'll be passing around the microphone so that we all audible. Thank you.
Thank you very much, John, and thank you very much to all the panelists, and particularly to my friend Ilya Mazenga for your comments. I can fully underscore what the panelists said. You were asking, John, about sustainability. With regard to sustainability of such projects, I see two major challenges. Number one, education and training. Because my experience is, here in this room, we are all convinced we can do a lot with laboratory diagnostics. But this is just us here in the room. There are many, many doctors outside in the country, in East Africa, in Sub-Saharan Africa, who do not know how important and how relevant laboratory diagnostics is in terms and how useful it is in order to improve patient care. So I would strongly encourage also a company like you, Roche, to set up more training opportunities, not necessarily facilities, but training opportunities for doctors, for healthcare providers in order to train them how to use laboratory diagnostics. This is absolutely necessary. It starts with the medical curriculum, and it goes on to the professionals. Second point, it is very important to transform such projects as we are doing here together at KCMC from seed funding, originally with seed funding, into a profit center. This will ensure, this is the only way to ensure at the very end sustainability of such projects. Such laboratories need to be able to, from a financial point of view, from an economic point of view, to stand alone, to be independent of our support from the outside in order to run in the long term and to provide this service. And this, at the very end, can only be achieved if we improve the reimbursement of laboratory diagnostics. The reimbursement from the national healthcare system, NHIF funding, something like that. Laboratory tests, also specialized laboratory tests, need to be included into the reimbursement scope and scale, because otherwise there are only very few patients, of course, who can afford this. And this is creating injustice. This is non-ethical, when only a few people in the country can profit and benefit actually from these opportunities. We need to broaden this, and we need to make laboratory diagnostics accessible to the entire population. So I think this is very important also for sustainability. Thank you. And thanks for this wonderful collaboration.
Thank you, Professor Hens. And for those who may not know Professor Hens, he leads one of the biggest labs in Germany, and he's also a visiting professor at Kilimanjaro Christian Medical College, and has been really helpful working with Dr. Maseka to transform the lab medicine ecosystem there. Thank you.
Yeah, good afternoon to everyone, and thanks to the panelists for your wonderful topics. So my question brings back the topic around access. Yeah. Now, we are aware that in the Sub-Saharan Africa context, most of the people who need these things, in many instances, cannot access the likes of KCMC. Like, we have a very difficult terrain. They live in the deep places in the village, and even just that commute to a proper testing center is difficult. Yeah. So I just wanted to find out from the team at Roche whether you've given any thought to innovating along reaching those people. Now, I understand that it is very difficult because there are places where there's no electricity, there's like the place is just a mess, but the patients are there, yeah? And it's important to be able to be relevant to the Sub-Saharan African context, to really think about that, because that's really where the problem of access is. So maybe you can give some thoughts around that topic, any of the panelists. Thank you.
Thank you, and I will invite Dr. Mapesi, who has been working with our medical strategy, thinking through some of those challenges you have mentioned, to give his perspectives. Thank you.
Yeah, thank you for a wonderful question. So we understand, and that's kind of a question that we've been getting for years, because some of our instruments are massive and for high throughput. But I think all you have seen in the news, one of the things that we've done recently is acquiring Lumira DX, which is typical point of care. So we know, like I said, if you want to reach more than 500 million people in Africa, we need those kind of solutions. So this is one of the ways that, as a company, we have to acquire them so that we can penetrate or we can reach hard-to-reach area with the very small devices for molecular diagnostics. I mean, we're still working with them, but this is something that like we have done as a company, really to reach out the hard-to-reach area.
Dr. Mapesi for that, and I believe it's a very concerted effort, the concern you have raised, because until every patient, regardless of where they are able to get care, we are not yet done with the journey. And I appreciate that each and of us in our little ways should be doing something about it. It's a journey, not yet there, but at least we're making some steps. Great. Any other question? Yes, sure.
I'm directing this question to Prof and Michael. Do you think, when we talk about the entire issue of universal coverage and the HIL, do you think somehow it has a bit of hindrance in quality diagnosis, especially now we have a lot of low-end products in the market, and as far as cost reimbursement is concerned?
Thank you for that question. And of course, the issue of universal health coverage, I think we are all pushing that, because for me, I think more people have access to hospital and to diagnostic, because our model, which we think we want most of the people to access the lab the way we do now. We're not going to change the prices, so we'll use the same insurance fee which we pay. But at the same time, we think that we also do business for those who have, those who can pay. Private patients will open that access to them. That will put that provision for course, the geographical position. We've also rich people there. So we'll do that one. We'll also be processing sample from other hospitals, so to improve the quality of care for those hospitals which they don't think they have to do that one. But also, since we are combining it with research, you know, if you do high-tech research, it's always source of revenue to make sure. So this is part of our business plan. But I think for me, I'm not worried, so long that we have more people with insurance. So more people will access, because as it is said now, we do a lot of exemption. Because many people they cannot access. So it's better than something so that we can reach more people from the community. Thank you.
Thank you, Howard, for your question. So from where I sit is, for UHC really to get to the level that you wanted to get, I think quality is a big aspect, because if the quality is not good, then we keep on repeating tests multiple times. And that adds the burden on the same system that we're trying. So we go with a cheap test or a cheap reimbursement rate. And then we keep on going back because we're not getting the right diagnosis, right? As opposed to getting it correct the first time, right? And to Professor's point here, I think sustainability is quite important. So I'm glad THS this time one of their key pillars is policy innovation. So this is where we need to have discussions with the National Health Insurance Fund, to bring them to the table and have this discussion and say, okay, this is what we're trying to achieve, and this is the way we'll do it now. With companies like Roche buying like Lumira DX, now we're able to offer the same level of quality, but for the smaller clinics, right? Then they can actually be able to get some level of access, and then keep on pushing until we achieve the right level of diagnosis. But it's very key for most of the little clinics, most of the hospitals to be profitable, for it to be sustainable in the long run. Otherwise, then we're going to be going back into the government office trying to increase the budgets, and it's a limited kind of funding that exists. So it's trying to be innovative, looking at different kinds of solutions that can play at the different level of hospitals, and the hospital can have a full level solution that we don't need to send patients out of the country which will also cost, which also a burden on the same system that we're trying to keep the cost at.
Thank you. I will take the last three questions all together, and then I'll have the panelists respond, because we have a hard stop at 12:30 to allow the other team come in. Thank you.
Thank you. Good afternoon. My name is Matman Tuanga from University of Dar es Salaam. Registered medical practitioner. Also, I'm a student of medical PhD candidate for medical tourism. Yeah, my question is, all my contribution is related to our imaging issues of medical tourism. Do you think, or do you see any future for using outbound medical tourism in relation to unlocking the future of diagnostic in Africa in terms of costing and time, waiting time in your hospitals? Thank you very much.
Medical tourism, the two doctors prepare an answer. Go ahead.
Good afternoon. My question is directed to Edwin from science, and I wanted to know the Roche initiatives towards drug resistance for diseases. I know you are doing a great job in but I wanted to know other initiatives like, for example, HIV, because currently the biggest challenge also in diagnostics is also drug resistance, where we have a lot of challenge towards HIV. Now we see a lot of patients are resistant to drugs that are prescribed, and also they're infecting the same strains of HIV to patients.
Thank you for that question. They will be getting ready. One last question from the room, right at the back there. Thank you, Hawa, for helping me.
Thank you. I'm Elizabeth, environmental doctor and researcher. I have a question. Recently, Gilead has licensed lenacapavir to several generic companies, and we know this will massively benefit sub-Saharan Africa. So my question to the diagnostics people, how does the future of diagnostics keep up with this, given that we will need to do lots of HIV resistance testing? How are we prepared for this shift that's coming in our country? Thank you.
Thank you, Doctor, for that. I think I will split the questions between the doctor. Dr. Harry, who is on infectious diseases, will answer your question. Dr. Masenga, who is setting up a center of excellence, will answer the medical tourism question. And Edwin will begin so that I can come and sit there. So Edwin, have the mic.
Thank you. The question was about drug resistance. So currently, where I can say we are actively playing in terms of drug resistance is for your TB patients, where we offer 3 types of tests for TB. The first one is for detecting TB, and if your patient turns out to be positive, we do first-line drug resistance testing for free. So it is offered for INH and RIF, which is offered as one test that is for free, but is only targeted for your patients who turn out to be TB free. For the others, for example, for HIV, it's something that we're still working on, so I can't talk much about it because it is not in public information, but there is work around it in the molecular lab. But
Thank you, Edwin. Dr. Masenga, go ahead.
Thank you. It's true that we've already established a business plan, and one of the goals is to how best we can attract medical tourism. And I think this is one of the goals for all these projects, so that we have extensive tests menu, which cover a wide range of diagnostic tests, so that we can attract people from all over. Because geographically, you know, since border Kenya, we see a lot of information from Mombasa. So having that in place, I think is going to attract this. And of course, as we advance in other areas like cardiology, neurosurgery, cancer care, comprehensive cancer care, all this, we've already seen influx of patients from outside Tanzania, from Kenya, Congo, Southern Sudan, they come and with improvement of diagnostic. So this will make it even better for us to attract medical talent. This is what I can say.
Thank you, Prof. Masenga. Dr. Harry, question was asked on HIV.
Thank you, Eliza. I think Eddie mentioned about HIV. My colleague Boniface is working on sequencing, so we have sequencing solutions for HIV. Although I understand your concerns like, okay, how much does it cost, how does it work? But this is something also we are working as a company. Another place that we are working on in terms of innovation is in HPV, extended genotyping, because we're receiving a lot of crime from that area. There's a big gap for different mutations. And the third part, as Eddie mentions, for our TB tests, we only do rifampicin and isoniazid, but we know currently with the rollout of new drugs like bedaquiline, so we need also to develop resistance tests for this test for molecular. So this is another third part where as a company we're investing a lot to see how we can drive innovations on that area.
Thank you, Dr. Harry. I see we have very few seconds left, but I will allow each of my panelists 30 seconds, starting from Michael. You can help me passing the microphone to just make their closing remarks. And as they do that, I'll also be inviting my colleague moderator from the Tanzania Health Summit to come on stage.
Thank you very much, Jenga. I think we have talked it to some extent, but it's to thank really the Tanzania Health Summit and the promotion for hosting such an event, and for the partnership of Roche, because this is where we come to the table, and this is where we can see the direction of healthcare is going and what innovations are coming up, and we discuss things and how it will impact our country, Tanzania, and the region in general. So thank you very much.
Thank you.
Maybe in closing is a call to action towards Tanzania having a national diagnostic strategic plan. It starts with planning and also under it to have an essential diagnostic list, talking in terms of reimbursement. The other thing is the conversation around how do we break the medical jargon to non-medics so that they can understand the existing gap and work towards increasing access to diagnostics, and looking forward to more and more partnerships in terms of increasing access to diagnostic and moving it from 19% and once to the right direction in terms of that trajectory. Thank you. And it was a pleasure sitting on the panel and listening to all of your questions. Thank you.
Thank you, Lucy.
I think for me it was a pleasure to be here, and I thank everyone for your participation. And my take-home message is partnership is key for any improvement in the healthcare system. We should embrace partnership, PPP, working with the government, working with the private sector, NGO, and the like. And I believe our project will be taken by Roche as a blueprint to be implemented to other areas in the country and in Africa.
Thank you, Professor Masenga.
First, I want to thank all of you for your time and for, although it's so hot, but you're still here. For me, my closing remarks will be, apart from partnership, I believe science and innovation is very important to moving forward. Like the last question that Eliza asked about how do we go through this kind of journey? How do we, as time goes on, as a pharmaceutical, as diagnostics, how do you follow? So I think for me that's very important, and that's the key thing apart from partnership and access, but science and innovation in the industry.
Thank you, Dr. Mapesi. And I will ask you not to leave because we might need to take a few photos. Allow my colleague to say something. Thank you.